Dysplasia refers to the abnormal growth and development of cells within a tissue or organ. It is characterized by alterations in cell size, shape, organization, and nuclear characteristics. This video aims to provide an educational overview of dysplasia, including its underlying mechanisms, causes, diagnostic implications, and potential progression to cancer. Dysplasia is a condition characterized by disordered cellular growth, typically involving the proliferation of precancerous cells. An example of dysplasia is cervical intraepithelial neoplasia, CIN, which serves as a precursor to cervical cancer. This abnormal growth often arises from long-standing pathologic hyperplasia, like endometrial hyperplasia, or metaplasia, such as Barrett esophagus. Note that dysplasia has the potential to be reversible, provided that the underlying stress or trigger is alleviated. However, if the stress persists, dysplasia can progress into a carcinoma, a stage that becomes irreversible and leads to cancer. Understanding dysplasia and its progression is vital for early detection and intervention in order to prevent the development of malignancies. Mechanisms of dysplasia. Dysplasia arises from genetic and epigenetic changes in the affected cells. These alterations can result from various factors, including chronic inflammation, viral infections, exposure to carcinogens, and genetic predisposition. Dysplastic cells exhibit abnormalities in cellular differentiation and maturation, leading to disorganized tissue architecture and an increased risk of further cellular changes. Causes and risk factors. Several factors contribute to the development of dysplasia, including 1. Chronic irritation and inflammation. Prolonged exposure to irritants or chronic inflammatory conditions can trigger dysplastic changes. For example, chronic inflammation in the lining of the cervix due to persistent human papillomavirus, HPV, infection can lead to cervical dysplasia. 2. Genetic predisposition. Inherited genetic mutations or alterations in genes involved in cell cycle regulation and DNA repair can increase the risk of developing dysplasia. Certain genetic syndromes, such as familial adenomatous polyposis (FAP), are associated with an increased predisposition to dysplasia and subsequent cancer development. 3. Environmental factors. Exposure to environmental carcinogens, such as tobacco smoke, asbestos fibers, or certain chemicals, can contribute to the development of dysplasia in various tissues. Diagnostic implications. Dysplasia is often detected through histopathological examination of biopsy specimens. Microscopic features indicative of dysplasia include cellular and nuclear atypia, altered cell architecture, increased mitotic activity, and loss of normal tissue organization. Dysplasia is typically graded as mild, moderate, or severe, depending on the degree of abnormal cellular changes observed. Progression to cancer. While dysplasia itself is not cancer, it is considered a precursor to malignancy, i.e. precancerous. If left untreated or uncontrolled, dysplasia can progress to invasive carcinoma. The likelihood of progression depends on various factors, including the severity of dysplasia, the presence of additional genetic abnormalities, and the specific tissue involved. Regular surveillance and intervention are crucial to prevent or intercept the progression of dysplasia to cancer. Management and treatment. The management of dysplasia depends on its location, severity, and associated risk factors. Treatment approaches may include 1. Surveillance and monitoring. Regular follow-up examinations, including repeated biopsies, are often recommended to monitor the progression of dysplasia and guide further management decisions. 2. Removal or destruction of dysplastic tissue. In certain cases, the removal or destruction of dysplastic tissue may be necessary. This can be achieved through surgical excision, laser ablation, cryotherapy, or other targeted interventions. 3. Lifestyle modifications. Addressing underlying risk factors such as smoking cessation, reducing exposure to environmental carcinogens, and managing chronic inflammation may help prevent or slow the progression of dysplasia. Conclusion. Dysplasia is an abnormal cellular growth pattern characterized by alterations in cell size, shape, organization, and nuclear characteristics. It is often associated with chronic inflammation, genetic predisposition, and exposure to environmental factors. Early detection and intervention are crucial in managing dysplasia to prevent or intercept its progression to invasive carcinoma. Regular surveillance, targeted treatments, and lifestyle modifications play essential roles in the management of dysplastic conditions. By understanding the mechanisms and risk factors involved in dysplasia, healthcare professionals can provide timely interventions and improve patient outcomes. Thank you for watching, and be sure to talk to your healthcare provider if you have any questions or concerns about your medications and any health conditions you may have. Disclaimer: the information presented in this video is for educational and informational purposes only. It is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified healthcare provider with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you have heard or seen in this video. We would like to express our gratitude to our sponsor, First Cup Coffee, the original seed, for making this video possible. Shop firstcupcoffeeusa.com. First Cup Coffee, the original seed, is dedicated to providing high-quality coffee that fuels your studies and work with a rich and invigorating taste. We appreciate their support in bringing you valuable, free educational content. Remember to visit firstcupcoffeeusa.com for your daily dose of exceptional coffee. That's a wrap for today's lesson. I hope you found this video informative and helpful. If you have any questions or topics you'd like us to cover, let us know in the comments below. Don't forget to like and subscribe to our channel for more educational content. Take care, keep studying, and I'll catch you in the next video. Bye.